So my name's Tony Pena, and I am at Washington Union High School, or Washington Union High School, yeah. So it's in Fresno, rural Fresno. I'm the patient care pathway coordinator there, and we have a medical assisting certification that we offer to our students. I also serve on the Cal-HOSA board as the board chair, and I'll introduce some of HOSA to you as we move through our slides if you're not familiar with HOSA and the benefits that it could bring to your students as well. I've been teaching for over 20 years. I'm a certified athletic trainer, and I have my master's in education. So let's talk a little bit about medical assisting. Medical assisting is an entry level position, and it's a really nice certification for our high school CTE programs. It's not difficult to integrate into a high school, and there's at least three certifying agencies that I'll talk about that can be used. So students after our program will be prepared to start that career as a medical assistant. Some of our students will use medical assisting as a part-time job as they go to college, and others will start their careers. For those that are looking at using medical assisting as a stepping stone, they're getting some amazing clinical experience and working right next to physicians and interacting with patients. So it's a great stepping stone for those students that want to get into some of the higher degrees of healthcare. But you can see here that the median pay is not bad um, as a career. And starting
Tony.
off, it's right around $14 to $15 per hour. And again, this is just the median salary here, so there could be more opportunity with experience.
Hey, Tony.
Yes.
Yeah, I don't know if I'm supposed to see your screen or a PowerPoint perhaps, but I
Oh,
don't
you're not
see
seeing
anything.
it. Okay, let me share my
Uh,
screen here. My apologies. All right, let's try that again.
yep, there you go. I see
So
it now.
yeah, the first two, you didn't miss too much. It's just an overview with the job outlook and then my entry slide there. But this is the pathway, and you can see here that it is a certification, and you can receive that certification through a high school degree or training, like at a junior college. There are some private junior colleges that also offer medical assisting certification. And they tend to separate clinical medical assisting and then administrative clinical or administrative medical assisting. So working in the front office or working in the back with physicians. And in my conversations with industry partners, they want a well-rounded medical assistant. So someone that can pick up the slack if they're down a person in the front office or vice versa. So you'll see that within my program, I try to cover all of the bases. So we do introduce the administrative portion of it, and then we also focus quite a bit on the clinical aspect as well. So there are three certifying agencies: so the American Association of Medical Assistants, the American Medical Technologists, and then the California Certifying Board of Medical Assisting. So it's a pretty competitive labor market, but here in California, this is the three different certifying agencies that the state recognizes, the industry recognizes. Um, the slides will be available, and these are QR links for all three of those agencies, and I'll show you all three of them here. There's not much difference between the three. This one here, the American Association of Medical Assistant, they would like to see a post-secondary medical assisting a program that they're coming from, so a junior college. So this agency is not the best one for us to use if we want to bring our program in-house. And I'll describe what our program looks currently, and eventually in the future, if we bring it in-house, what we plan on doing as well. this is the American Medical Technologist, and their website is very easy to navigate, and they give you this checklist, which is really nice. So if you were to apply to bring that certification in house and cover all the courses, this is that little checklist that you would use to see whether you offer all of these courses or content in your courses for your students. So this serves as a nice little checklist. So we work with Fresno City College, and most of our classes are dual enrolled. But Fresno City College is the certify not the certifying agency. They use the California Certifying Board of Medical Assistants for their certification. But they're the resource that we use for our dual enrollment courses. And because I have my master's, I'm able to teach most of the classes that are required prerequisite for them to then take their clinicals and other more advanced classes for that certification. So there's a lot of programs that will teach phlebotomy in their medical assisting programs. And what I wanted to show everybody by showing this slide is that phlebotomy is a completely different certification. Medical assistants don't do any phlebotomy. They will do injections if necessary, but if you need your blood drawn, you're going to go to the lab, and there's going to be a phlebotomist there that will draw your blood. So they're different professions. There are some schools that will do a phlebotomy certification, but it does require that a phlebotomist teach that class. But as you can see here, there's different levels for phlebotomy, and it does require a high school diploma to then get that certification, along with hours of training and then punctures that they've done under supervision and an exam as well. So in our program, we do offer that MA certification, and then we also offer industry certifications that are recognized and that are useful for a medical assistant. So the main one is the BLS, so the Basic Life Support Certification. And this is a step up from the layman's course that all teachers take in order to get their credential. This is going to take it a step further, and it's for the professional rescuer or the healthcare provider. We also give our students a HIPAA certification through Biologics Solutions, and this allows them to be HIPAA compliant so that they understand going into a healthcare setting that there are things that cannot be shared, and how do they protect that aspect of the medical record for their patients. And then the last certification that we issue our students before they leave our program is bloodborne pathogens training. And we do that through the American Red Cross. I serve as an instructor for the American Red Cross, and I can do like layman certification and bloodborne pathogens training. But the American Red Cross is not the industry standard for CPR. So what I do is I contract an outside agency that comes in and does the BLS certifications for our students. And then I do the bloodborne pathogens training for our students. And then I'll do just regular CPR certification for our faculty and anybody in our district as well. So part of our program requires our students to be a part of our CTSO, so our Career Technical Student Organization, which is HOSA. And if you're not familiar with HOSA, HOSA is to healthcare students what FFA is to ag students. So it gives them an opportunity to be exposed to leadership opportunities. We have a board of officers that work with our chapter, and they organize events throughout the year for us to do. And then they also represent the chapter once we go into the conferences, our state conference and our regional conference as well. So there's multiple conferences that students can attend. There's regional ones that are close to the school within that region. There's a state conference, and then we also have a national conference slash international, because there are a few countries outside of the United States that travel to that conference. But again, this is just a way for students to see what it would be like to be a professional and have to do those continuing education units and be a part of an organization that encourages your growth in that profession. So this gives them a taste of that aspect, and then it also allows them to compete in a wide range of competitions. Students that place in first, second, or third then qualify to go to that international conference. This year, our state, or next year, our state conference will most likely be in Long Beach, and our international conference will be in Nashville, Tennessee. So we have a lot of dual enrollment courses within our pathway. So I do like to kind of give everybody the rundown of dual enrollment and things to consider if they're thinking of bringing a dual enrollment class or multiple classes into their school. One thing that I tell parents and students is that it is a double-edged sword. So there's really good positives that come from dual enrollment, but if you're not doing your part and are not committed to the coursework, there can be some consequences. And that the biggest negative consequence is that college GPA. So if students fail a class, it is they might hold back that financial aid that you would get once you graduate high school and then go into college. So we definitely try to outline that to our students and our parents before they start those classes. The classes that I do teach as that professor and that dual enrollment, it makes it easy for me to have an idea of where the students are going, so that if necessary, within those first couple of weeks, we can drop them from that dual enrollment, but still keep them in the class so that they get the high school credit for the course. So it does help. If a student doesn't do well, they do lose the opportunity to continue taking those college classes while they're in high school, so that we don't affect that transcript, that college transcript. We do make sure that our credits are transferable at least as an elective, and we do discuss that with our teacher, or our students and our parents, that some of the credits at times, depending on what school they decide to go to, may not transfer. So they have to check that. It does start their college transcripts, so it's a permanent record. And then there are some really good things. I mean, it does bump up your high school GPA. Unlike AP classes, you do not have to take that exam at the end of the class to then receive that credit. It opens up the doors to scholarships. Colleges are now looking to see whether students are doing dual enrollment courses. We do require that our parents and students sign a FERPA, and then the communication between the instructor, the program, and the parents has to be, widely open, and there has to be a nice, communication set there. The professors that come from the junior college will treat the students as adults, because they have signed that FERPA. It does give us access to their grades, and then it also allows us to then place someone within our high school, some instructor, some adult, to oversee the classes and kind of be the middle person there to guide the students and help even with the communication between the professor and the students. There is a lot of paperwork that goes into dual enrollment. Before each of the classes, there's documents that need to be signed by all parties. And we do have a dedicated counselor for our pathway, but they do get pulled to do other things. So it can be a bit stressful from the counseling perspective as well. And they have to be very well versed on dual enrollment. So this is what our current pathway looks like. And I've highlighted in different colors to represent our introductory courses, our concentrator courses, and then our capstone. I know there's a lot of schools that would not consider medical terminology a concentrator, so we offer, many different classes that could fall under that concentrator. But our freshmen will take an introduction class to allied health, and they get a wide range of tastes from different careers that they could potentially go into. So they start to explore during that freshman year. We offer medical terminology, which is one of those prerequisites to get that medical assisting certification. And then their junior year, they're doing medical law and ethics. And our capstone is allied health and medical wellness, which is an ROP class as well. And our school has a senior project that needs to be completed before students graduate. So we take that on within our capstone classes. There's additional classes that they do take online. Pharmacology, they'll take their clinicals, their lab procedures, advanced clinicals, diagnostic procedures, and then their work experience, which is 160 hours at a clinic working as a medical assistant, so that they can qualify to sit for the exam. So these classes, for the most part, are online. And then as students graduate our program during the summer, they dedicate themselves to finishing up the coursework that's necessary for their MA certification. Their externship might extend into the fall, but we try to support them in any way, even after they've graduated. So recently we received a facilities grant. So we're going to start building our own facility with our medical assisting lab and also a sports medicine lab for our students. And we've restructured some things. And we reached out to Fresno City College and asked if we could offer more dual enrollment courses for our students. So we use this checklist that we talked about earlier, and down the line future, we can eventually then bring that certification in-house if we wanted to. But this is what our next year's freshman class will start with. And students that have already been in our program, we're going to try to incorporate some of these other classes as well as they prepare for their graduation. So this is the wrong slide, so let me move. There we go. So this is the one that I wanted to show you. So we've integrated those prerequisites that we had originally in our pathway, and then we've added other courses. So this is all a semester base, and our students will now be taking summer classes as well. So our incoming freshmen will be taking a Counseling 53, which will help them with all of their dual enrollment courses as they move forward from there, kind of gives them a base. And then we have also noticed that we need to have our students at reading grade level. So our students will be doing Reading Plus to get them to reading level or even beyond reading level. And that's what we cross our fingers that we can accomplish. We have seen students that are not at reading level struggle with some of the coursework as they get into those upper division courses through the program. But this is that allied health class, that introduction class that I showed you in one of the previous slides. This is a medical assisting administrative, like front office class that will not be dual enrolled. It will be just through the high school. And there's going to be simulation software that we will be using to kind of train our students in that front office work. Here's that medical law and ethics class that they would be taking their junior year. Now it's during the summer. Their medical terminology class, their sophomore year, along with a human bio class, which is very similar to anatomy and physiology. Summer of their junior year, they would be taking a math class, followed by pharmacology, the fall of their junior year, and then a psychology class for that spring semester. Then in the summer, they start to do their clinicals and their lab procedures, along with our capstone class that senior year. And what we're looking forward to is that they're doing their work experience that spring semester of their senior year and graduating from our program with that medical assisting certification. Um, Fresno City has also offered us nursing prerequisites. So I've added a few slides with other possibilities for pathways. So if you wanted to do medical assisting and nursing prerequisites for like an LVN at Fresno City College, there's additional courses that can be taken for that. And I also teach a sports medicine pathway. So this would be the coursework that we would be using for that pathway as well. And let me backtrack a few slides back and finish with this. Some of the challenges that someone trying to do a medical assisting program might run into. We talked about reading assessments and trying to get them to reading level. We are looking at some type of math assessment, especially now with the pandemic. We don't really have reliable data from our students as they come into our program. So we're going to be talking with the math department and seeing if we can establish some kind of math assessment. Students that are not at grade level with math will start to see issues when they start to get into like pharmacology or the math class that they would be taking in their summer coursework. A dedicated counselor for the pathway is optimal. I know that it's not always feasible for a district, but it's something that I would definitely recommend. Some type of adjunct on campus, someone that could help with overseeing classes or even transportation. So before we have our facilities and have that lab available for our students, we're going to have to transport our students to Fresno City College. Thank God that it's not too far away from us, and we can definitely bus or even use vans to get our students there to do their clinicals. Yeah, some resource teacher to supervise that dual enrollment course, appropriate instructor qualifications. So as you get into those upper division courses that are based on medical assisting, you'll need a medical assisting instructor or a registered nurse. My background, my expertise is in sports medicine. I'm a certified athletic trainer. So at some point, we're going to have to bring in that adjunct instructor, or if we're bringing this in-house, hire a medical assistant or a registered nurse to take care of those courses. And of course, there is equipment, there is textbooks and resources that need to be purchased. So that tends to be where the largest part of the budget comes from when you're starting off or establishing a medical assisting program. So at this point, I'll open it up to any questions that you might have.